If you are a medical student too, let's start learning GIT medicine. And today's topic will have upper GI bleeding. So first we have, of course, we know that we have upper and lower GI bleeding. In what purpose, at what place, we'll define it. Like what is the exact position we'll define it is upper or lower. So there is a ligament of Treats there, which is also known as duodenojejunal flexure. This is the point where the upper one is called upper GI and the lower one is lower GI. So in upper GI bleeding, we will have the blood in the vomiting or from the mouth. We'll vomit plus blood, we'll call it as hematemesis. If we talk about the etiology, first we'll talk about the esophagitis. In esophagus, we have this reflex esophagitis, infective and chemical and eosinophilic. First, it's Barrett's esophagus. Barrett's esophagus is basically the changes in the squamous epithelium, which is normal cells of the esophagus, which will convert into columnar epithelium along with the goblet cells is seen. By the way, it's important for the exam perspective if you are preparing for the exam. Then it leads to adenocarcinoma, which leads to bleeding. Second, we have varices. Esophageal varices. The most common cause is portal hypertension. What is portal hypertension? You can see we have this esophagus and the vessels here around, they are swollen, and the blood you can see has dilated this, and they can even rupture anytime. And the veins around esophagus, they dilated and can rupture. And then third, we have Mallory-Weiss syndrome, which is basically a tear at cardioesophageal junction, and it is a superficial laceration which is along with the chronic vomiting or retching, coughing or straining. It is the self-limiting condition. It will get better with time. On fourth, we have erosive gastritis. It is mucosal erosion of this mucosa of the stomach, and the bleeding along with symptoms or not along with symptoms. Here you can see the erosions of the stomach. Most common cause, we see the NSAIDs use, which inhibits the COX pathway. COX pathway is inhibited, then the gastroprotective enzyme is inhibited, which causes erosive gastritis, and due to alcohol also. So for the treatment, we'll give PPI or H2 blockers. Then we have on the fifth, mass lesions, or it is polyps or any carcinoma related.